The HRSA EMS for Children program is implementing 3 new EMS-related performance measures. The 3 new measures for the program are submission of NEMSIS version 3 data, pediatric emergency care coordination, and skill checking on pediatric-specific equipment. These measures might sound daunting, but remember, you'll have 10 years to achieve them. Let's discuss the 3rd measure, regarding the use of pediatric-specific equipment. This measure is designed to assist EMS personnel to maintain their skill level to care for pediatric patients. The measure reads, the percentage of EMS agencies in the state or territory that have a process that requires EMS providers to physically demonstrate the correct use of pediatric-specific equipment. This measure will require data collection from all or a random sample of the 911 responding EMS agencies in your state or territory, both transporting and non-transporting agencies. The detail on the required data collection can be found in the new EMS for Children Performance Measures Manual. NEDARC will work closely with you throughout the data collection process. Throughout this video, we will be hearing from Eric Hicken, New Jersey's EMS for Children Program Manager, Tom Winkler, former Pennsylvania EMS for Children Project Director, and Morgan Skaggs, Kentucky's EMS for Children Project Director, as they explain the importance and benefit of incorporating pediatric skill checking into an agency training program in order to demonstrate the correct use of pediatric-specific equipment.
So from previous EMS for Children surveys administered by NEDARC, we know that a vast majority of ambulances in the country carry most or all of the pediatric equipment that is recommended at the national level. That's great. That's wonderful that we know that. The next step now is, do people know how to use equipment? We need to do skill checks on providers in a variety of ways to know that they can actually utilize the equipment we know that they're carrying. When it comes to kids, I think almost every single EMS provider and healthcare provider in general, unless they're specialized in kids, has some level of apprehension, of perhaps nervousness or fear when they have to deal with a child, especially a very sick child. So we need to know, and we want the providers to know and feel comfortable with utilizing the equipment that they are carrying on their vehicles or in the hospital setting that they have in their hospital. So having them do skill checks is one way to improve their confidence in dealing with a pediatric patient.
Continuing education is a familiar topic for EMS personnel. Providers already need to complete continuing education to maintain their license and often have regular training within their agency to maintain and update their skills in accordance with changing protocols. Continuing education courses and training are vitally important for maintaining skills and are considered an effective remedy for skill atrophy. Pediatric EMS encounters are often rare, so there's little chance for providers to practice the needed skills in the field. Studies have shown that specific clinical skills of EMS providers deteriorate over time when not regularly practiced in a training setting or actual patient encounter.
When it comes to frequency, we've got a ton of research that shows that both knowledge and skill performance degrade over time, and that the more often an individual practices a given skill, the more competent they're going to be in the performance of that skill. The repetition leads to increased speed and accuracy in the performance of those skills. And our pediatric patients make up such a small percentage of patient encounters in EMS, which naturally leads to fewer opportunities to perform those skills on real patients. That gap in performance we have to make up for with increased practice.
One of the reasons skill checking providers is important is because in the pediatric population, we don't see peds all that frequently. And the equipment we use, we don't use all that frequently. So when it comes time to pull that equipment out, you want to make sure that you've used it in a controlled environment so that you know how to use it when the time comes. It's just like anything else. When you're using something frequently, it sticks with you, you get better at it. If you're not using it, you lose it. So whether you're using it once a year on a real patient, you need to, throughout the year, use it over and over. Whether that's quarterly, every 6 months, It's got to be pulled out and used.
One study by Lammers and colleagues showed performance deficiencies over time in pediatric resuscitation skills for paramedics. One of the reasons could be that EMS medical directors and paramedic instructors cannot assume competency simply because a skill is occasionally used in the field or because a paramedic can pass a written examination, especially when opportunities to apply knowledge and skills are rare. The optimal frequency for skill checking is unknown. However, skill checking at least twice a year, when possible, for pediatric patients seems to be an important process for patient care and patient safety.
You have to go through a problem-solving step that a lot of times we don't have to do with skill performances on adults. I think a perfect example of this is when it comes to drug dosing or medication dosages. The majority of the medications we use in EMS, it's a standard dose for all of our adult patients, and our pediatric dosing is weight-based. So coming back and practicing those skills over and over and over to get that repetition down, to build the muscle memory, to make sure we're maintaining competency for a skill that we seldom get to perform in the field, but is a high-risk scenario. It's a type of situation and a skill that carries significant consequences to doing it incorrectly.
Miller's model of clinical competency framework indicates that performance assessment can be demonstrated by a combination of task training, integrated skills training, and integrated team performance. The HRSA EMSC program determined this model could be best translated to the following 3 areas: demonstration of pediatric skills via a skill station, demonstration of pediatric skills via a simulated event, and demonstration of pediatric skills via a field encounter. During these scenarios, individual providers and teams practice and demonstrate their knowledge and skills in assessing and formulating a plan to treat pediatric patients, including the use of correct pediatric equipment for appropriate interventions. Using these different methods of skill evaluation is necessary for EMS providers to ensure their readiness to care for pediatric patients.
Repetition and doing the skills will improve the provider's ability to care for children, but also having someone able to show them how to properly do the skill, how to properly utilize equipment that they honestly don't use that much, will also improve their ability to care for children and will improve the health care that children receive. Doing repetition, doing similar skills over and over will make the providers feel more comfortable with doing them, and also their ability to do the skill will be improved too.
The goal for this measure is that by 2026, 90% of EMS agencies will have a process that requires EMS providers to physically demonstrate the correct use of pediatric-specific equipment. Ideally, agencies will use a combination of evaluation methods where providers demonstrate their competency multiple times a year. Frequent skill checking can be a part of a quality assurance or improvement program for an agency. This will allow EMS training officers and educators to target specific skills and deficiencies when developing continued education at their agency to ensure providers are prepared for pediatric emergencies. You may be wondering how these specific skill checking methods may affect outcomes.
So as time goes on, we will know, as right now we're establishing our baseline data on who's doing competency evaluations, who's not, and seeing how EMS agencies are looking at the competencies of their EMS providers. So we'll have that baseline data. We will then, be able to see as time goes on, does that affect care? We'll be able to look at outcome data and compare between agencies that do multiple forms of competency evaluations and agencies that don't, or maybe only do one type. And we'll be able to look and see, does this improve care? And as I foresee this being a few years down the road at a minimum, we'll also be able to tell these same state agencies, organizations, this is how you would do it. This is how agencies have achieved, this much better outcome for pediatric patients by doing these specific types of competency evaluations.
Through frequent skill checking, the HRSA EMSC program would like to ensure providers know how to use equipment and feel comfortable caring for children, thus increasing competency and reducing anxiety. Skill competency is an important and vital part of pediatric patient safety and care.